After the age of 65, the heart doesn't always give loud warnings. Sometimes the signs are quiet, a bit of pressure, slight dizziness, or just unusual fatigue. But the risk of a heart attack isn't quiet. It doubles, and the consequences can change everything. This isn't about fear. It's about knowing what's coming and protecting what matters. Your time, your independence, your life. Most people over 65 are walking around with risk factors they don't even know about. But there are proven, practical steps that can make a powerful difference. And the sooner you start, the stronger your heart can stay. If you're someone who values simple, trusted health advice made for real life after 50, this is your place. Click subscribe and stay with us for videos that care about your heart, your years, and your everyday strength. Missing a morning dose of heart or blood pressure medication isn't just a small oversight, it can lead to serious consequences, especially after age 65. Some doctors warn that the early hours of the day are when the heart is under the most pressure. Blood pressure naturally rises in the morning, and the heart works harder as the body shifts from rest to movement. Skipping medication during this time leaves the heart unprotected at its most vulnerable. Studies have shown that the risk of a cardiac event, including heart attacks and strokes, significantly increases in the hours after waking, particularly in older adults. This is why many cardiologists recommend taking heart-related medications first thing in the morning, unless advised otherwise by a specialist. These medications are often designed to stabilize blood pressure, thin the blood slightly, or regulate rhythm, all of which are crucial during the high-risk early morning window. Seniors who miss doses may not feel immediate symptoms, but the effects can build silently, placing added stress on the heart muscle and arteries. Over time, irregular timing can weaken the body's defense against clots, sudden pressure spikes, or arrhythmias. Experts also note that consistency, not just the medication itself, is key to long-term heart protection. Using a pill organizer or setting a daily reminder can help ensure regularity. Even if breakfast or a walk feels like the start of the day, the real protection begins with the first pill. Keeping medication on schedule is one of the simplest, most powerful ways to reduce heart attack risk. Walking for at least 20 minutes a day offers powerful protection against heart attacks, especially for adults over 65. It's not just about staying mobile. It's about keeping the heart healthy in a safe, natural way. As people age, blood vessels tend to stiffen, circulation slows, and the heart must work harder to push blood through the body. Gentle, consistent walking helps reverse some of these effects. It improves the elasticity of arteries, supports steady blood pressure, and encourages the heart muscle to stay active without being overworked. Doctors often recommend walking because it poses very little risk while offering substantial cardiovascular benefits. It's one of the few activities that both calms and strengthens the body at the same time. Research shows that walking regularly helps regulate blood pressure, which is one of the most important factors in preventing heart attacks. Even mild increases in physical activity cause the blood vessels to expand and contract naturally, promoting better circulation. This makes it easier for the heart to deliver oxygen and nutrients throughout the body. A study published in the American Journal of Preventive Medicine found that older adults who walked at least 20 minutes a day, 5 days a week, reduced their risk of heart disease by more than 30%. That number grows higher when walking becomes a daily habit. In addition to circulation, walking also plays a critical role in controlling weight. As metabolism slows with age, maintaining a healthy weight becomes more difficult, and even small weight gain can increase strain on the heart. A short daily walk helps burn extra calories, manage blood sugar, and prevent abdominal fat buildup, which is directly linked to heart attacks. The benefits extend beyond the physical body. Walking supports emotional well-being by reducing stress hormones like cortisol, which can otherwise raise blood pressure and inflame blood vessels. When done outdoors, walking also increases vitamin D from sunlight exposure, which has been shown to support overall heart function. For seniors, the goal isn't distance or speed, it's consistency. The heart responds best to routine care. Even walking around the house or taking short strolls through a garden adds up when done regularly. Walking after meals, in particular, helps stabilize blood sugar and prevents sudden pressure changes that stress the heart. Some cardiologists suggest walking in the morning when the air is fresh and temperatures are stable, but the best time is the one that fits into daily life and can be repeated. A pair of supportive shoes, a safe path, and a quiet commitment are often all it takes. Unlike medications or complicated fitness routines, walking doesn't require prescriptions or equipment. Yet, it brings similar benefits: reduced risk of blood clots, lower cholesterol levels, and improved heart rhythm. It becomes a rhythm of health itself. For those over 65, walking transforms from a simple habit into a daily defense. It gently reminds the body how to stay alive, strong, and in motion. And for the heart, that motion means everything. Packaged meals, chips, cookies, and microwave dinners are common in many homes. But for adults over 65, these ultra-processed foods can quietly increase the risk of heart attack. Many of these products contain trans fats, excessive sodium, and artificial additives that directly harm blood vessels. Trans fats, which are sometimes listed as partially hydrogenated oils, can raise LDL cholesterol while lowering HDL, the protective kind, creating the perfect conditions for arterial plaque to build. Sodium, found in large amounts in frozen meals and snacks, causes fluid retention and pushes blood pressure higher, placing extra strain on an aging heart. The problem isn't always obvious. A single frozen entree or a small bag of chips may seem harmless, but when eaten daily, even in moderation, these foods contribute to low-grade inflammation. That inflammation spreads through the bloodstream, affecting the lining of arteries and making them more prone to narrowing or clotting. Some doctors warn that for seniors with a history of high blood pressure or cholesterol, these effects can be even more dangerous, as they may not feel any symptoms until a serious event like a heart attack occurs. A study published in the Journal of the American College of Cardiology found that people over 60 who consumed high amounts of ultra-processed foods had a significantly higher rate of cardiovascular events, even after accounting for other lifestyle factors. What makes these foods especially risky is how easy they are to rely on. Many seniors choose them for their convenience, quick to heat, easy to chew, and long-lasting on the shelf. But convenience often comes with a cost. The preservatives and emulsifiers used to maintain flavor and texture have been linked to disruptions in gut health, which in turn can affect inflammation levels and heart function. In some cases, the packaging may use words like low-fat or heart-healthy, but the ingredient lists often reveal hidden sugars, synthetic oils, or high levels of sodium that work against heart protection. For older adults already managing blood pressure, cholesterol, or diabetes, these additions quietly undermine progress. The heart's ability to stay strong in later years depends heavily on the quality of food it's given, and ultra-processed options often offer the worst kind of fuel. While they may be tempting for their ease, they bring with them a slow, steady burden that the heart must carry. Reducing their presence in the daily diet can have an immediate and lasting effect on cardiovascular risk, especially when replaced with simpler, less altered meals. Even small changes, one less packaged snack per day, can reduce inflammation and help the heart recover its natural rhythm and strength. Omega-3 fats, found naturally in fatty fish like salmon, sardines, and mackerel, play a powerful role in protecting the heart after age 65. These healthy fats help lower triglyceride levels, which, when too high, can lead to plaque buildup in the arteries. Omega-3s also reduce inflammation throughout the body, easing pressure on the cardiovascular system and making arteries less prone to sudden blockages. For seniors, this matters deeply. As blood vessels become more delicate with age, reducing silent inflammation becomes essential. Some cardiologists recommend omega-3s not only for those with heart disease, but also as a preventive measure in older adults. A clinical study published in Circulation found that omega-3 supplements reduced the risk of fatal heart attacks by improving the heart's electrical stability and helping prevent arrhythmias, or irregular heartbeats, which are more common with aging. Fish oil supplements, when approved by a doctor, are one way to increase omega-3 intake, but whole food sources, like a few servings of grilled salmon per week, offer both nutritional value and gentle digestibility. What makes omega-3s especially important for people over 65 is their ability to support overall vascular flexibility. As arteries stiffen with age, the heart must work harder to maintain normal blood flow. Omega-3s improve the inner lining of the blood vessels, encouraging smoother circulation and helping reduce the strain on the heart during daily activity. They also offer mild blood-thinning effects, which help prevent clots, one of the most immediate causes of heart attacks. Even among healthy seniors, a small but consistent intake of omega-3 fats has been associated with lower rates of cardiovascular death. These fats support a calmer, more resilient heart rhythm, which becomes increasingly important in later years. Some doctors advise caution with over-the-counter supplements, especially when combined with blood thinners, but dietary sources are widely considered safe and effective. Choosing meals that include sardines, trout, or flax seeds, which also contain plant-based omega-3s, can bring quiet, consistent protection to the heart. It's a simple step, but one with deep and lasting benefits for seniors aiming to reduce heart attack risk without medication changes or intense routines. Loud snoring, choking sounds during sleep, and daytime fatigue may seem like common signs of aging, but they can point to something far more serious: sleep apnea. For adults over 65, ignoring these signs can quietly raise the risk of heart attack. Sleep apnea causes repeated pauses in breathing throughout the night, sometimes for just a few seconds, sometimes longer. Each pause disrupts oxygen flow and puts sudden strain on the heart. Over time, this constant stress leads to elevated blood pressure, irregular heart rhythms, and greater wear on the cardiovascular system. Some doctors warn that untreated sleep apnea doubles the risk of heart failure and significantly increases the likelihood of stroke or heart attack, especially in older patients with pre-existing heart conditions. What makes sleep apnea especially dangerous is its subtlety. Many seniors don't realize they have it. They may assume tiredness or forgetfulness is normal for their age without realizing that poor sleep quality is affecting every organ in the body, especially the heart. When breathing stops during sleep, the oxygen level in the blood drops sharply. The brain signals the body to wake up just enough to resume breathing, often without full awareness. This cycle repeats dozens, even hundreds of times each night, preventing deep rest and forcing the heart to work harder than it should. The result is long-term cardiovascular strain that can remain unnoticed until a major event occurs. Several large studies have confirmed a clear link between sleep apnea and heart disease. According to the Journal of the American College of Cardiology, older adults with moderate to severe sleep apnea are far more likely to experience heart attacks, arrhythmias, and sudden cardiac death. The condition also worsens hypertension and makes blood pressure harder to control with medication. In many cases, patients who address their sleep apnea with proper treatment, such as a CPAP machine or lifestyle changes, experience significant improvement in both blood pressure and heart rhythm. Simple signs can serve as warning flags. If snoring is loud and frequent, or if a sleeping partner notices pauses in breathing, it's worth discussing with a healthcare provider. Morning headaches, dry mouth, and memory problems can also be linked to sleep-disordered breathing. For seniors, treating sleep apnea can mean more than just better rest. It can lower blood pressure naturally, stabilize heart rate, and reduce the risk of sudden cardiac events. Some specialists even report seeing lower levels of inflammatory markers in the blood after successful sleep apnea treatment, suggesting that the heart and blood vessels begin to recover once oxygen flow is restored. Ignoring snoring or disrupted sleep might feel harmless, but after age 65, the consequences become more urgent. Heart health doesn't only depend on diet and movement, It also depends on breathing well through the night. Paying attention to sleep quality and acting on warning signs is a powerful step toward protecting the heart where it matters most, in the quiet, unseen hours when healing should be happening. A handful of nuts each day may seem like a small detail, but for adults over 65, it can make a significant difference in heart health. Nuts like walnuts and almonds contain natural compounds that support cardiovascular function, including healthy fats, plant-based proteins, fiber, and antioxidants. These nutrients work together to lower LDL cholesterol, the kind that clogs arteries while preserving or even boosting HDL cholesterol, which helps remove harmful fats from the bloodstream. For seniors, this balance is critical. As the body ages, its ability to manage cholesterol and blood pressure naturally weakens. Introducing heart-supportive foods like nuts can help restore that balance without requiring drastic dietary changes. Walnuts are especially rich in alpha-linolenic acid, a type of omega-3 fatty acid that's been shown to reduce inflammation, improve arterial function, and stabilize heart rhythms. Almonds, on the other hand, are packed with magnesium, a mineral that supports blood vessel elasticity and helps regulate blood pressure. Studies published in journals like Circulation and the American Journal of Clinical Nutrition have repeatedly shown that people who eat nuts regularly, even just a few servings per week, have lower rates of heart disease and sudden cardiac death. These findings hold especially true for older adults, who benefit most from small, consistent dietary improvements. For many seniors, nuts also serve as a better alternative to processed snacks like crackers or sweets. They provide satiety, or a feeling of fullness, which helps manage weight, another critical factor in heart health. Carrying excess weight, particularly around the waist, increases the heart's workload and raises the risk of hypertension and type 2 diabetes, both of which contribute to heart attacks. Replacing just one daily snack with a small serving of unsalted nuts can reduce overall calorie intake while supplying protective nutrients. It's a change that feels minor, but supports the heart every single day. Concerns about fat content in nuts are common, but most of the fat they contain is monounsaturated or polyunsaturated, the kinds associated with better cardiovascular outcomes. These fats improve the structure of cell membranes in the heart and arteries, making them more resistant to damage. Some cardiologists advise seniors to choose raw or dry roasted varieties without added salt or sugar to gain the full benefit without unwanted additives. Portion control still matters. A small handful, about 1 ounce or 28 grams, is enough to provide the benefits without overdoing calories. Nuts also contain compounds like arginine, which helps the body produce nitric oxide, a natural chemical that relaxes blood vessels and improves blood flow. For older adults at risk of high blood pressure or plaque buildup, this gentle expansion of the arteries can reduce strain on the heart and lower the likelihood of clot formation. Unlike supplements or medication, nuts offer this support through food, in a way the body understands and accepts easily. Incorporating nuts into a daily routine is a quiet, lasting form of heart care. They don't require preparation, scheduling, or reminders. Just a simple habit that adds up over time. For seniors focused on reducing heart attack risk, this small change carries the weight of long-term protection. Sitting for long periods without movement may feel harmless, but for adults over 65, it can silently increase the risk of heart attack. When the body stays still for too long, especially while watching TV, reading, or using a computer, blood flow slows down and the heart must work harder to maintain circulation. This lack of movement affects more than just muscles. It directly impacts the arteries and the blood itself. Sitting for more than 90 minutes at a time can lead to poor circulation, higher blood pressure, and a greater chance of clot formation, all of which raise the risk of heart-related events. Some doctors compare long periods of inactivity to smoking when it comes to cardiovascular damage, especially in seniors whose heart function may already be under strain. One of the key issues with extended sitting is how it allows blood to pool in the lower legs, reducing venous return to the heart. This forces the heart to pump harder, which over time contributes to vascular wear and tear. In aging bodies, where vessels may already be stiff or narrowed, this additional stress can be dangerous. Studies have shown that prolonged sitting raises markers of inflammation in the blood, the very inflammation that promotes plaque buildup in the arteries. In fact, research published in the Annals of Internal Medicine concluded that older adults who spend large portions of the day seated have a significantly higher risk of cardiovascular death, even if they exercise later. The problem lies in uninterrupted periods of stillness, not just the total amount of sitting. Breaking up sitting time is simple but essential. Even standing up for a minute or walking across a room can reset blood flow and relieve the pressure on the heart. Some cardiologists advise seniors to stand or stretch every 30 to 60 minutes, especially during passive activities like watching television or sitting at a dining table. Light movements, such as shoulder rolls, leg lifts, or a short walk to get a glass of water, are enough to engage the circulatory system and support the heart. These small breaks help prevent blood from thickening and reduce the risk of clotting, which is especially critical for seniors with a history of heart disease, high cholesterol, or diabetes. In many cases, people may not notice how often they sit throughout the day. It becomes a quiet routine: meals, reading, television, phone calls, and before long, hours have passed without movement. For adults over 65, awareness is key. Setting a reminder to move or using visual cues like keeping a walking stick or timer nearby can help. Movement doesn't have to be strenuous to be effective. It just needs to happen regularly. The heart thrives on rhythm, not just in its beats, but in how the body treats it throughout the day. Short, frequent movements keep the heart resilient and reduce the hidden dangers that stillness can bring. Tracking blood pressure at home offers one of the simplest, most effective ways for adults over 65 to reduce their risk of heart attack. As the body ages, blood vessels become less flexible and more prone to pressure fluctuations. These changes often happen silently, without warning signs. Home monitoring helps catch these shifts early, before they lead to serious events. Many cardiologists recommend at-home blood pressure checks because they offer a clearer picture than occasional readings at the clinic. Stress during doctor visits, known as white coat syndrome, can cause artificial spikes, while home readings show how the heart behaves in daily life. This kind of ongoing insight helps both patients and doctors respond more accurately, adjusting medications or habits before things escalate. Consistent home tracking also helps identify patterns. Some people experience higher readings in the morning, while others may see spikes after meals or before bedtime. These patterns matter. Studies have shown that people who monitor their blood pressure regularly at home are more likely to maintain healthier averages, take their medications as directed, and experience fewer cardiovascular events. One study published in Hypertension found that older adults who used home monitors had a significantly lower risk of heart-related complications over 5 years, especially when combined with regular follow-up from a healthcare provider. For seniors, the right device matters. Automated digital monitors with large screens and upper arm cuffs tend to be more accurate and easier to use. It's important to use them while sitting quietly, with the arm supported at heart level. Some monitors store past readings, making it easier to share trends with a doctor. Others connect to mobile apps or print reports, which can help track progress over time. Doctors often recommend checking at the same times each day, usually morning and evening, and averaging the results for better reliability. But even occasional readings are better than none, as they offer vital clues the body may not show outwardly. What makes home monitoring so valuable is its ability to give control back to the individual. Instead of waiting for a yearly exam to discover a problem, seniors can detect shifts in real time. This sense of awareness reduces anxiety and empowers action. When someone sees their blood pressure creeping up, they can speak to their provider sooner, change something in their daily routine, or reassess medication. This quick feedback loop may prevent emergencies before they start. It also builds confidence, reminding seniors that heart health is something they can influence directly, not just something that happens to them. In a time when healthcare can feel distant or overwhelming, a simple home monitor becomes a quiet ally. It speaks clearly, without guessing. It reveals patterns the body hides, and for older adults who want to stay ahead of risk, it provides reassurance, direction, and peace of mind, one reading at a time. Bottling up stress or anger after the age of 65 can place serious hidden pressure on the heart. Emotional suppression may not seem dangerous on the surface, but it quietly triggers a cascade of internal changes that affect blood pressure, heart rhythm, and inflammation levels. When someone holds in frustration, grief, or anxiety, the body responds as if it's under threat. Stress hormones like cortisol and adrenaline rise, tightening blood vessels and making the heart beat faster and harder. Over time, this strain wears down the cardiovascular system, raising the risk of a heart attack even in those who seem physically healthy. Some cardiologists note that patients with unexpressed emotional stress often present with higher blood pressure and more irregular heart rhythms, especially during early morning hours when the heart is most vulnerable. For seniors, the challenge is that stress often shows up in subtle ways: disrupted sleep, lack of appetite, fatigue, or tension in the chest that's mistaken for something else. Retirement, loneliness, grief, or major life changes can all trigger emotional pressure that never gets addressed directly. A large-scale study published in the journal Circulation found that older adults with high levels of chronic emotional stress had nearly double the risk of heart attack, even when their diet, exercise, and cholesterol levels were under control. This suggests that stress, even when silent, has a direct and damaging effect on the heart's ability to stay stable and responsive. Holding in anger is particularly dangerous. The heart responds sharply to feelings of rage, even when those feelings are unspoken. Blood pressure rises, blood vessels constrict, and platelets become stickier. A perfect storm for a cardiovascular event. In fact, research from Harvard Medical School indicates that the 2 hours following an episode of intense anger are when the heart is at its most fragile, with a significantly elevated risk of heart attack or stroke. For those over 65, where heart resilience has already declined, this can be life-threatening, but expressing emotions in a healthy way offers protection. Whether through conversation, writing, spiritual practices, or light movement, the act of releasing emotion reduces internal tension and supports steadier blood flow. Emotional expression doesn't mean confrontation or drama. It can be as quiet as writing in a journal or speaking to a trusted friend. Some doctors even recommend daily practices like breathing exercises or soft stretching, which calm the nervous system and bring down heart rate and pressure naturally. These simple habits lower cortisol levels and encourage the body to exit fight or flight mode, the very state that makes heart attacks more likely. Seniors are often told to stay calm and avoid stress, but the real danger lies in pretending. Stress isn't there. The heart listens to every unspoken worry, every silent resentment, and if those emotions stay locked inside, the heart carries the weight. Letting go, slowly and safely, becomes not just emotional healing, but physical. Prevention. In the quiet moments when the heart rests, it finds strength again in relief, not in resistance. Drinking enough water, especially in the morning, plays a vital role in protecting heart health after age 65. Dehydration thickens the blood, making it harder for the heart to pump and increasing the risk of clot formation. This becomes especially dangerous in older adults whose blood vessels may already be narrowed or less flexible. When the body lacks fluid, circulation slows down, blood pressure can drop or spike unpredictably, and the heart may need to beat faster to compensate, a strain that can lead to cardiac stress or even a heart attack. Some cardiologists warn that even mild dehydration can trigger chest discomfort or dizziness in seniors, symptoms that should never be ignored. The morning is the most critical time for hydration because the body has gone several hours without fluid during sleep. Blood tends to be more concentrated upon waking, and this early period is when many heart attacks occur. Studies have found that water intake shortly after rising helps thin the blood slightly, easing its flow through the vessels and reducing pressure on the heart. This gentle fluid boost supports smoother circulation and helps prevent sudden spikes in blood pressure, a common issue for people over 65. A simple glass of water upon waking acts like a reset for the cardiovascular system, offering support at a moment when the body is shifting from rest to active function. Some seniors unintentionally drink too little water throughout the day. Thirst sensations become weaker with age, and certain medications, like diuretics or blood pressure pills, may further dehydrate the body. Relying only on thirst as a guide is often not enough. Health experts often suggest starting the day with 1 or 2 glasses of water before tea, coffee, or breakfast, and continuing to sip small amounts regularly. This habit helps maintain consistent fluid levels and prevents the heart from having to work harder than necessary. It also supports kidney function and electrolyte balance, both of which play a part in heart rhythm stability. There's also a clear link between dehydration and stroke risk. When blood is too thick or sluggish, clots form more easily, and the chances of blockages increase. For adults over 65, especially those with a history of hypertension, the simple act of drinking water becomes a powerful line of defense. Some studies suggest that adequate hydration can reduce stroke risk by up to 60% when combined with blood pressure control and movement. It's a striking number for such a small habit. Hydration doesn't require fancy drinks or supplements. Plain, clean water is best. Drinking too much at once isn't necessary. The key is steady, consistent intake. For seniors looking to protect their heart, the first glass of water each morning is more than refreshment. It's quiet prevention. It supports the blood, eases the vessels, and lightens the heart's load. And in a world where many risks are complex and hidden, water offers one of the simplest, clearest steps towards safety.